So if you're like me, you're probably feeling a little tired today after we changed our clocks to spring forward. Sleep is so important for our mental and physical health. So springing forward actually impacts our sleep health. 9 Health expert Dr. Payal Kohli is here to talk about all this for today's Mental Health Monday. Good morning, Dr. Kohli.
Good morning.
So let's talk about daylight saving time. How does it affect us?
Actually, believe it or not, spring forward is actually a little worse for our bodies than fall backwards is.
Yeah.
And what happens is we have an internal body clock that's regulated by light and dark. That's called the circadian rhythm. And that controls the release of a sleep hormone called melatonin. So when we travel internationally, that gets messed up because light and dark gets switched. Yep.
Exactly.
So basically, daylight savings is sort of a mild form of jet lag, so to speak. And what it can cause is not just a feeling of grogginess and tiredness and irritability for a couple of weeks after, but it's actually been associated with an increased risk of inflammation, heart attacks, and car accidents.
And really that's because of the lack of sleep?
And so basically we get an extra hour of light in the afternoon, which means it's still dark in the morning when we wake up.
Got it.
So our clock is not synced up with the light and dark cycle, and that causes the hormones to be released in an abnormal fashion, and that's why we feel that. Now we adjust usually about a week or two later, and we kind of come back to where we were when we started. But experts are now saying we should try to get rid of daylight savings times because of the effects on our health.
Exactly. I mean, they're sounding very bad.
Yes.
Talk to me about some sleeping disorders. You bring up narcolepsy as a common one.
Yeah, so narcolepsy occurs in about 25 to 50 out of 100,000 people, and it's a very debilitating sleep disorder. And essentially what can happen is you can have excessive daytime sleepiness, but also these sleep attacks, which can happen when you're walking, driving, cooking, or even talking to somebody else. You just fall asleep all of a sudden, and that can last for a few minutes, up to 30 minutes. Yeah, and it's thought to be a deficiency of a chemical in the brain called hypocretin that regulates wakefulness. Now, in addition to the sleep attacks, you can have hallucinations, you can have temporary sleep paralysis, which means you get paralyzed as you're falling asleep or waking up.
That has happened to me before. It's scary.
It is very scary. And it can affect your social life, your personal life, your professional life.
Yeah. You know, I think I heard you saying this in the newsroom earlier, but there are some famous people that have narcolepsy, right?
There are a number of movie stars that have narcolepsy, and actually the sad thing about the disorder is it often doesn't get diagnosed until later, even though it usually presents between the ages of 10 and 30. But people just say that you're not taking care of yourself, you're not following sleep hygiene, and that's one of the reasons we're talking about it today, to raise awareness of the condition, that it's actually a chemical imbalance leading to a sleep disorder.
So how is it treated?
It's a tough thing to treat, unfortunately, but we usually use a combination of medications and lifestyle changes. So we try to say avoid alcohol, follow regular routine, don't do daylight savings time, and you can't help, right? Exactly. And stimulants and antidepressants to help regulate kind of your sleep and wakefulness. But it's tough. It's a tough thing. It can affect your ability to drive and your ability to work and all of those types of things.
So what's your advice for people? I mean, should they plan to sleep an hour earlier? What do you do to offset that time loss?
That's a great question. If you know it's coming, and you always do know that it's coming, you actually start going to bed 15 minutes earlier every day for like the 3 or 4 days before. And that really helps to adjust at least the nighttime bedtime routine. And it helps to get your body ready for that change in day or light. So
that's great. I've never heard that before. Makes sense.
Yeah. So next year we have to remember to do that.
All right.
Yes.
Thank you, Dr. Kohli, for
Thank
coming
you.
in. Marty, we're going to send things over to you. And by the way, for more information, you can go to 9healthfair.org.